Hey guys, it's Dr. Justin Marcagiani here. Today we're going to do a quick video on iodine. Should you use it for thyroid issues or not? We're going to dive in. Before we do, make sure you hit that like button, give me a thumbs up, put your comments down below. Let me know your thoughts on the matter and your experiences using iodine. All right, awesome. So a couple things here. We have this process known as iodination, where we take iodine, we bring it into the cell, and we help make thyroid hormone. So when we make thyroid hormone, we're taking basically tyrosine and we're binding it to 4 molecules of iodine. That's called iodination. So we take iodide, which is basically 2 molecules of iodine together. So iodide can get broken up and converted into iodine. That's not a problem. It can be used by the thyroid, breast tissue, prostate. So we need a couple hundred micrograms to make thyroid hormone. We don't need a ton. Now the question is, people that are maybe in the Rust Belt or Goiter Belt, areas where there's a lot of iodine deficiency, you want to make sure you're at least getting a couple hundred micrograms in your multivitamin every day. Now, if you have a lot of inflammation in your thyroid, you have known Hashimotos and it's not stable, significant elevation in TPO or thyroglobulin antibodies, right? Maybe your thyroid's swollen, maybe your hormone levels aren't even stable yet. You got to be very, very, very careful with any additional iodine outside of what may be in food. So you have to be very careful with that. So I always tell patients out of the gates, any active autoimmune issue, you don't really want to look at iodine out of the gates. You want to look at all the other companion nutrients, especially selenium, zinc, magnesium. You really want to look at all of the inflammatory foods that would be avoided on an autoimmune diet: nuts, seeds, grains, legumes, refined sugar, processed foods, dairy, all those things, cut them out. So autoimmune template out of the gates, really focusing on good nutrients. If you're getting a couple hundred micrograms in a multi via an iodine, it probably isn't that big of a deal. It just depends upon how hot your thyroid is. Again, there's a lot of different foods that have iodine in it too. Of course, we have higher iodine foods like seafoods, like dulse is one that's really high. I'm going to pull up a list here right now so you guys can have it. I use a website called myfooddata.com. It's pretty nice. When you go in there, you can click on the different nutrients or minerals or vitamins that you want to look at. Okay, and so right here out of the gates, we'll just put in iodine, and we'll pull up a bunch of different food options for iodine. But of course, your seafoods are going to be really high. Any of your seaweed, dulse, those kind of things are going to be extra high. There's some good paleo foods too. I'll go over here in a second. All right, so out of the gates, what do we have? So things like seaweed, right? We already talked about that. Cod, fish, right? Shrimp, turkey, tuna, eggs. They got a little bit of iodine, right? One large egg has 8% of your iodine in a day, okay? Shrimp, for instance, 3 ounces of shrimp, you got 25% of your iodine for the day, right? 3 ounces of cod, over half your iodine for the day. So decent fish, you can get a little bit. Now, if you have an active autoimmune thyroid issue, you're probably okay getting iodine from whole food sources, maybe with the exception of seaweed, just because the levels are so high. Meaning like it's so nutrient dense in iodine. So you got to be careful with that. We definitely need iodine for thyroid function. The debate becomes how much. Okay, you have people on one side of the camp like Dr. Brownstein that say you need milligrams of iodine, right? We're going to use a Lugol solution and we're going to give you 10, 15, 20, 30, 40, 50 milligrams of iodine a day. Again, the RDA for iodine is like 150 to 250 micrograms. So 1,000 micrograms is a milligram, and these people are saying 10, 20, 30 milligrams per day. So very high level. So I tend to always be a little bit careful when we're using iodine because it's one of those nutrients you can actually decrease thyroid function when you go too high on it. It's called the Checkoff effect. So you can really shut down thyroid function. Imagine you have the sodium iodine symporter, right? Imagine you have this bridge, right? This is called the symporter, right? And you have inside the cell and outside the cell. Iodine has to come in via the sodium iodine symporter. It goes right in and it goes from the outside the cell in. So imagine when you put a ton of iodine in your bloodstream, basically it creates a traffic jam across this bridge called the sodium iodine symporter. So it can really jam up and actually prevent iodine from going in. That's why some people, they actually do mega doses of iodine to treat Graves' disease. And I think part of it is they basically clog up that sodium iodine symporter and prevent iodine from getting in the cells. And that's one mechanism, one support for Graves. So knowing that, I'm kind of, one, reluctant to give high doses because I know it can jam up that symporter, and two, I know that iodination process, when you're making thyroid hormone, right, the 4 iodines bound to tyrosine, you can spit off a lot of hydrogen peroxide in that process, and hydrogen peroxide can be very inflammatory, and so things like selenium are very helpful because they help neutralize hydrogen peroxide and turn it into water, right? Hydrogen peroxide is H2O2 and water is H2O, so it pulls off an extra hydrogen. So you have one hydrogen less, and now you're H2O versus H2O2, which is, water's obviously benign. So it's good to have good selenium, good to have good zinc, magnesium, CoQ10. So I really want to be focused on all these other nutrients when we have a thyroid issue. I want to really work on diet. I also want to look deeper at adrenal hormones, insulin resistance. I want to look deeper at gut function, gut inflammation. So it's never going to be, hey, take your thyroid hormone, you're good. Hey, take your iodine, you're good. It's going to be looking at other factors. Now, once other factors have been looked at and stable, if you want to play around gently increasing up iodine, we can do that. And I do it with patients, but we do it slowly and we do it when we're stable, and that can be helpful. But outside of that, we can always look at some of those really good nutrient-dense foods, shrimp, cod, right, your various seafoods, some of your turkey, those kind of things, eggs, all really good nutrient-dense sources. And if you're getting a couple hundred micrograms in a multi, as long as your thyroid's not very hot and having an active autoimmune issue where it's really hot, then I think you're probably okay out of the gates. But if you have an autoimmune thyroid issue, you really want to work with a good functional medicine doctor that can really make sure all the issues are being addressed and nothing's being missed regarding all the other downstream issues, right? Got to look at the adrenals, got to look at blood sugar, got to look at gut inflammation, got to look at low stomach acid, nutrient absorption, gut infections, low levels of glutathione. All of those things play a major, major role out of the gates. All right, so if you guys have questions at all or you want to dive in deeper, feel free and click down below, and you can schedule a consult with myself and or my colleagues worldwide. We're happy to help and serve you. If you enjoyed the content, give me a thumbs up, give me a share. Really appreciate it. And in general, if you're enjoying the content, make sure you subscribe too so you get more great notifications of it coming your way. All right, let me see what else here. We're going to just move into a quick little Q&A here, see if I can help you guys out with some questions. All right, let me see what I got here out of the gates. Okay. I heard a PhD nurse say that chronic parasite infections are a normal part of human condition. Do you agree with that? Definitely not. Definitely not. In a third world country, for sure, right? That's very common, but that's why parasites and amoebic dysentery are like a top 5 cause of death. So it's a big major cause of death in those countries, not here. And that's part of the reason why people hear conventional doctors say they don't really recognize it, because they're used to the presentation of parasites as like a tropical disease in these third world countries, right? So it's very common. And also there's a presentation of parasites being extreme. Like you have to have the chronic diarrhea all the time. And you may have more subclinical parasite symptoms, and it may not rise to that suspicion. And a lot of the conventional testing, on the functional, or I should say on the conventional medicine side, they're not going to usually pick it up. They're not sensitive enough unless there's a large amount of parasitic material there. Do you recommend supplementing with Pedialyte when fasting? No, Pedialyte's crap. There's a lot of high fructose corn syrup in there. You're much better off doing just some really good electrolytes in some water. That's a much better way out of the gates. If you need a little more glucose, you could always add in like some coconut water to give you a little bit more, or even just some bone broth too. The corner of my mom's left eye started to get red seemingly randomly a couple times last week. Any possible remedies? Not scratchy, just red. Yeah, it could be a sty. Could be a sty going on there. I mean, you can always, I'm not sure exactly what to do on that. I mean, you could put a little bit of witch hazel on it. You could do, just trying to think what could be the issue. You could always do a little bit of bentonite clay or some kind of salve to help kind of drain it or pull it out. So I would look at some kind of a drawing salve that can really help calm it down. It's a good product on Amazon that you can look for. It's an Amish drawing salve that may be helpful as long as it doesn't get in the eye. That could be good. Wisdom tooth, just got mine out yesterday. What products do you recommend for quick recovery? What foods do you recommend to eat after? I mean, of course, all soups, bone broth, things that are going to be easy on your tummy and easy to digest. Things like collagen, vitamin A, from cod liver oil, extra anti-inflammatory support, right? Good curcumin, things like that are going to be excellent out of the gates. Maybe even some probiotics, just because of the fact that you may have been on some anesthesia that could have affected your microbiome while you're on it. Okay, good. How to treat Hashimoto's? Well, that's going to be a podcast question. Can't do that in a quick little Q&A like this. Questions like this during the Q&As are just got to be poignant to the point questions. Big picture stuff, go look at a podcast or a video that I've done, justinhealth.com, and you can search there and you can find it. Would you be worried about cod liver oil if someone has Hep C? No, I wouldn't. As long as the quality of cod liver oil is good, wouldn't have a problem. Matt writes in, would you recommend a 4-point saliva cortisol test whether you need more adrenal support, currently taking 25 milligrams of DHEA and 10 milligrams of pregnenolone as part of TRT, taking 30 milligrams of Armour? Yeah, I mean, I'm a big fan of the total cortisol with the free, so I like the Precision Analytics Dutch testing. If you want to pick up a Dutch test from me, you can go to justinhealth.com/shop, click on the lab test category, and you can find it. I like that one because you can look at free and total cortisol. Getting my thyroid tested, I've been feeling swollen in the area, all of a sudden swelling in the supraclavicular area that's here. Anything to start to do to help? It really just depends on what the underlying issue is. Too broad in general, but you can always do natural anti-inflammatory supports and ginger and or essential oils on that area like frankincense to help. Is a teaspoon of seaweed good per day? I'm not sure. That may be a lot. That may be too much. It depends on your thyroid and how much iodine you're getting. Hope it helps. Anything that helps rosacea, yeah, autoimmune. I mean, it's a big autoimmune issue, right? So got to look at getting the food dialed in, see how you do there. And I'm a big fan of some of the Marie Voronique skincare products. I would look at some of those to be very helpful and nourishing to your skin microbiome, and then look at all the diet and gut stuff. I work as a dental assistant, and I'm worried about exposure to environmental toxins at work. I'm thinking pursuing a career in chiropractic. What do you think? Dental assistant, yes, it just depends. If you're a dental assistant, I would be working at an office that specializes in natural dentistry, so you're not going to get exposed to a whole bunch of toxins. Again, you are going to have issues with removing mercury probably, right? Because a lot of natural ones do that, but usually there's extra air filtration, there's all kinds of extra precautions that are taken. So I'd probably look at working at a natural dentist instead. All right, guys, hope that helps. I got to jump on here with the patient. Hope you guys enjoyed today's content, and if you did, feel free to share it. Put your comments below. Make sure you